I had the opportunity to watch an interview today. It was with a critical care physician in Ontario. Her name is Dr. Callie Barrett. And this interview was difficult to watch. Dr. Barrett was describing the conditions currently in Ontario hospitals and critical care units during this third wave of COVID. It's April 2021, and we are experiencing a third wave. Many of the things that Dr. Barrett said sounded extremely familiar to me, and in a few minutes I realized why. Many of the things that she was sharing reminded me of my own thoughts about the crisis in long-term care. I'd like to share Dr. Barrett's words in that context. I have immense respect for my colleagues who are working in critical care. I can't imagine the strain of working in that environment. I want to share my perspective from working at a different end of the care spectrum, that of geriatrics and frailty. Dr. Barrett spoke about the scarcity of resources and how difficult it is to watch people suffer when there just aren't enough beds or skilled people to look after the adults, patients who need to go into these beds. To quote her specifically, she indicated that additional beds is a lovely gesture, but it doesn't solve the problem because it takes a lot more than a physical bed and an oxygen tank to take care of these patients. It takes an incredibly complex, multidisciplinary team that we work in and requires highly skilled personnel. And that's true in long-term care also. One long-term care patient requires a family physician, but sometimes also consultations with geriatric medicine, geriatric psychiatry, behavioral supports or transition workers, social workers, registered dietitians and dietary aides, nurses aides or practical nurses, and personal support workers, not to mention family who are also essential caregivers. The skill set that these teams need is different than that's required in long-term care, but it is a skill set, and it takes time and experience to hone the skills to look after complex, frail, long-term care patients. Also, to quote Dr. Barrett, she indicated that there were difficulties with the triage system. Quote, "Let's say I had two patients that were in the emergency department who were critically ill, and I only had room to accommodate one more. I would be asking a group of independent clinicians to make an assessment on who's more likely to benefit from that ICU bed, based on their past medical history, how sick they are at that moment, and the person who's most likely to be alive and survive that critical care admission would be the one that gets the bed, and the other one would be offered the full medical care that we could give up to critical care. But if that patient is not doing well and they're in pain and suffering, we would offer palliative care. It would mean that there would be people who would die who otherwise would have had a higher likelihood of surviving." And she went on to say, "I can't believe I'm saying these words." I can relate to that. Making difficult decisions about who gets access to certain healthcare resources is heart-wrenching. And that happens in critical care, but also in other resources, like who is going to get additional personal support worker hours? Who's going to get an admission to long-term care? Who is going to move up higher on a crisis list? These things are not clearly a matter of life and death, but they can be for care partners. We know that care partners who are undergoing care partner strain do have a higher risk of depression and even death. It can be extremely difficult to make a decision about who gets these resources and who is going to have to stay with the best possible care that can be given without additional resources like additional personal support workers or a long-term care or respite admission. Dr. Barrett shared, quote, "The moral distress that this is going to create for my colleagues and my profession as a whole is people will quit, people will leave, and this is going to be horrific and devastating to us all, but way more horrific for the patients and their families and friends." I can't think of a better analogy than a war. The really tragic thing is that those in the line of fire are the most vulnerable in our society. And this is a dilemma that we're experiencing in working in long-term care and with frail older adults as well. It can feel like a war sometimes, and it's hard to know who the enemy is. In this case, it's not a little virus, but it's the entire healthcare system, ageism, and other determinants of health that have contributed to the person's frailty. Sometimes we get a sense that things didn't have to be this way, and it's really lamentable and difficult to see. It really hit home to me when I heard this quote from Dr. Barrett. The people getting sick may or may not have the agency to speak up if they're in an unsafe environment. It's affecting those with the least social capital to be able to speak up for themselves, those with the least amount of representation right now in cabinet and in government, and it's completely unmasked the inequities in our society. And this is true. Many of the older adults who are caught between a rock and a hard place right now are those who are vulnerable in almost every sense of the word. Medically vulnerable, certainly, living with chronic diseases and conditions that can make decision-making and advocacy difficult, but also socioeconomic difficulty. People who can afford to hire extra help, who have family members who can take time off work or relocate to come and help them, are often in a much better position to be able to wait for long-term care or to mitigate the lack of services that are available. And that's an inequity. There can also be challenges like cultural and language barriers, barriers related to sex or sexual orientation or gender identity that can get in the way of a person getting care. And those are amplified when we're dealing with older adults with frailty and during this pandemic. Now, you might be feeling kind of down with this video, and it is kind of a downer video. It's got some negative things to think about. I want to share another difficult quote, and that was from a lawyer and senior advocate, Laura Tamblyn Watts. She says, quote, "We have blood on our hands. We have a genocide of seniors, and we're seeing it still happen again. We haven't learned the lessons. When you know that older people are dying and you refuse to give the measures required to save them, there's nothing else to call it but a genocide." Unquote. She went on to say, quote, "Most of the infectious threat is coming in through staff, and staff can't often afford to take time off, particularly women who are often racialized and low income who are working in these homes. So 10 to 14 days of sick leave would make a huge difference," unquote. I can't single-handedly change policy around sick leave or wages, but I think it's really important to consider this part of the puzzle when it comes to looking after our frail older adults. Some of the facts about the impact of the COVID pandemic on older adults are very hard to hear. 3,755 older adults who are living in long-term care have died from COVID. In the first few months of the pandemic, 81% of deaths were older adults living in long-term care. A year or so later, since the pandemic started, that number is now around 53%. But that is shockingly high. And many of these deaths were preventable. There are 1.3 nurses per 100 long-term care patients in Ontario, and 2.3 personal support workers for every 100 patients. If you've ever looked at the care plan for a complex and frail older adult who's living in long-term care, you would be boggled in terms of how that staffing level could take care of such a complex person, even if we take into account essential family caregivers who sadly have been restricted from seeing their older adult family members for much of the pandemic. I mentioned that this video has a lot of negative information, and it certainly does, but there's a lot of hope as well. It's so encouraging that the discussion about long-term care and looking after frail older adults is happening in the media and in our country. I hope this discussion continues. I want to share that this pandemic has given me a new energy for the work that I'm doing with my social media and my YouTube channel. Recognizing that there are low staffing levels, that the needs of older adults living with frailty are incredibly complex and multifaceted. It makes me want to recommit to providing education to fill the gap. When people who are on the front lines have the skills and education that can help them to provide better care to older adults, it will help people to live better. Thanks so much for watching, and I'd be really interested in hearing your perspective. If you work on the front lines of long-term care or another setting with older adults, what is it that you need to know? Or what do you want other people to know that would make your job easier? Join me here on YouTube or on my website, thewrinkle.ca, for more.